Now, the reason we're all wearing our masks in here is because it's crowded and we're indoors. Now, good morning, Queensland, and can I give some very reassuring and good news again this morning. So we have 3 new cases. Now, one was the partner of the cleaner that we advised everyone of yesterday afternoon, and we have 2 further in hotel quarantine, a father and a daughter. So that is fantastic news, and once again I do want to thank everybody for doing the right thing. We now have 28 active cases, and in further good news, we've had over 13,480 tests overnight as well. So let's remember, everyone, if you are sick, stay at home and then go and get tested, and stay at home until you get that result. It's very, very important during this period, especially people in that Greater Brisbane, if you have any symptoms whatsoever, to come forward and get tested. Before handing over to Dr Young, I just want to say how personally grateful and proud I am of the work that everybody has been doing during the lockdown and now post-lockdown. It's great to see. There were people, obviously it was crowded, crossing some of the streets today, and people had their masks on. So once again, if you're in doubt, wear your mask. And the Q&As are out there. I urge everyone to have a look on the website about where and when you should be wearing it. And of course, don't leave home without it, especially in that Greater Brisbane region. Just put it in your pocket or your handbag as you walk out that front door and have it with you. And if you are feeling compromised at any stage, put that mask on. But hopefully everyone's reading the Q&As, and I thank everyone for their cooperation during this period. So I'll hand over to Dr Young.
Thank you, Premier. So, excellent news overnight. We've had those 3... I apologise, thank you. I just forget I have it on now. So, excellent news overnight. We now have those 3 new cases. One is the partner of the cleaner who acquired the infection at the hotel where she was cleaning. So he became unwell the evening of the 7th. So he went into quarantine in the morning and was tested in the morning, and he tested negative in the morning, so that's really good. Then he developed some extremely mild symptoms that evening. So the 2 days before he went into quarantine potentially could be a risk. So I am asking people who went to any of the venues that he went to please immediately come forward and get tested. The risk is low, but the risk is there, so I really ask you to come forward. So those 2 venues he went to, on the 5th of January, he went to the Bunnings warehouse at Acacia Ridge between 2 p.m. and 2:40 p.m. Then the next day, on the 6th of January, he went to the Sunnybank Cellars at Helliwell Road in Sunnybank Hills between 2:05 and 2:15 p.m. He also went to work those 2 days, but he works at a fantastic workplace who had already tested all of their staff because his partner had tested positive, so they'll do that again now, and they've done a fantastic job, so no one needs to worry about the workplace he works at. But those 2 sites, if anyone's been there, whether or not they have symptoms, they need to come forward and get tested immediately. If they're not sure what to do, they can always ring 13 Health. As we find out who the people are, through working with those sites, we'll also ring people. But it's far quicker if people could hear this message and come forward. Then we had another 2 cases who have recently returned from Lebanon, and they tested positive day 10 in the hotel. So that's fine, so we'll manage those 2 cases as we all do. So we're now up to 28 active cases in Queensland, a total of 1,281 cases, and as the Premier said, we've done more than 13,000 tests in the last 24 hours, which is fantastic. It's really, really important that anyone who has any symptoms anywhere in the state, no matter how mild, immediately comes forward and gets tested. Outside of places that we've notified in the media, if you don't have symptoms, you don't need to come forward and get tested. But if you've been to any of the venues. Now, I am going to go through those venues again because they're all still very important. So the Woolworths Callumvale North between 11 a.m. and midday on the 3rd of January. The Coles Sunnybank Hills Shopping Town in Sunnybank Hills on Tuesday the 5th of January between 7:30 and 8 a.m. And the Nextra Sunnybank Hills Newsagent on Tuesday the 5th of January between 8 a.m. and 8:15 a.m. So anyone who's been to any of those three sites or those two new sites, Bunnings and the Sunnybank Cellars in Acacia Ridge and Sunnybank Hills, it is really, really important you come forward and get tested. Some other news, although this is actually more relevant to Victorians, and we'll get this message out to them, we do not require Victorians who come into Queensland as of today to get tested unless they have symptoms. So we were requiring them to be tested when they came into Queensland and isolate till they had a negative result. We now only require them to get tested if they have any symptoms. So that's a change because we've done a risk assessment of Victoria, and given the reduction in risk, Victorians can still come into Queensland as they have been able to all along, but they only need to get tested if they have any symptoms. No matter how mild those symptoms, doesn't matter what the symptom is, they need to get tested and isolate till they get a result. Thank you.
Once again, we thank Queenslanders who have come out, record numbers to get tested over the last 24 hours, 13,482 tests. And I'm pleased to say over the last 5 days, since we first notified Queenslanders of this UK variant in the community, we've had 79,419 tests. So that's over the 5 days. What we know is there are 3 key tools that we have that we need Queenslanders to take up to make sure we can manage this virus throughout 2021 while we work with the Commonwealth and all the states and territories to roll out the vaccine. They are tracing, testing, containing. Tracing, when we put up on our website and we notify the public of sites that a positive case has been at, we need people to come forward. That's what you can do for us, for Queensland, is come forward and let us know if you have been to any of these sites, including the new ones that we have announced today, which are the Bunnings warehouse at Acacia Ridge and also Sunnybank Cellars at Hellawell Road, Sunnybank Hills on the 5th and 6th of January. Secondly, testing. We need people to come forward and get tested. We want to see our high numbers continue. We want to make sure that we have high rates of testing across Queensland at all times. That way, we have a much clearer idea of whether we have any community cases in Queensland. We need high numbers of testing. And I'm pleased to say since COVID first appeared in Queensland, we've done over 1.6 million tests. So thank you, Queenslanders. And containing. If you go for a test, you must stay home until you get your test results. If you have a mandatory quarantine order, you must stay home for those 14 days. It is a lawful direction. But also for containing, social distancing, hygiene and masks. If we do this, we can manage this virus throughout 2021 while we roll out the vaccine. So we want people to make sure that they are doing that. Now, businesses, including gyms, we've had a lot of questions on gyms. Can I just make sure that gyms are wiping down equipment? It is not enough just to wear masks, and we have given clarification as to when masks need to be worn in gyms that are indoors, but it is important that we do not relax in relation to gyms simply because people are wearing masks. We must make sure we are wiping down equipment as well. Why is this important? The UK has had 30,000 deaths in 30 days. 30,000 deaths in 30 days. New York, sadly, are now reporting that 1 in 500 New York residents have died from COVID. We cannot be complacent in Queensland. We need to make sure we are tracing, testing, containing. So please, Queensland, we know you've done an incredible job over the last 12 months. We need you to continue doing that. We want you to come out in large numbers to get tested. If you have any symptoms, no matter how mild, anywhere in Queensland, whether you're a visitor to Queensland or a resident of Queensland, of course, checking the website. If you've been in South Brisbane and been to any of those sites, please come forward so you can be assessed as to whether you are a close contact or not. And of course, help us contain. Stay home if you're waiting for your test results. Please social distance, best hygiene measures, washing your hands and using sanitiser. And of course, where it's mandatory to wear a mask, you must wear a mask. Where it's voluntary, please assess where you think that you need to wear it because you cannot social distance. Then, as the Premier said, if you are not sure, then wear the mask. But it is mandatory to carry your mask at all times in Greater Brisbane at the moment, and we thank Queenslanders for their willingness to do this, and we've seen many people out with their masks today, so thank you.
So good morning, everyone. I'm happy to say that similar to the work that was done by our community and our police and other agencies over the weekend, the transition to the new arrangements in the area impacted in South East Queensland has been going very well. Since we started on Friday, our police officers have handed out 1,937 masks, and we've issued only 22 penalty infringement notices, which means another 2 in the last 24 hours. The message is really quite simple. So if people want to intersect with our police officers and not have any issues, but also do the right thing, please carry a mask at all times and wear it when you should. So the onus is on all of us as members of the community to understand what the requirements are about wearing the masks. Our police will continue to carry and offer masks to those persons that don't have them when they should. We will always give people the opportunity to comply with the directions. However, if people choose not to do that, there are strict penalties that apply, and up to a $1,300 fine could be imposed. I should also mention that Sydney remains a hotspot, and we've seen since the 18th of December 963,000 border declaration passes issued, and in the last 24 hours we had 5,784 vehicles intercepted at our borders, 35 persons refused entry, and at our domestic airports 3,842 passengers processed and 4 refused entry. So things remain quite busy in that space, and it's always important that people remember travelling to Queensland that those restrictions still remain in place. And finally, I should mention that the joint Queensland Health and Queensland Police investigation into how the breach of the hotel quarantine occurred is underway. It will be an investigation that if we identify things that need to be improved in the system, that we will implement them immediately and keep you advised of what's happening with that. Thank you.
Any questions?
Do we know yet about Man, the partner of the hotel owner? Is it the UK strain?
I might get Dr Young to address that. So are there any other questions for me? Then I'll hand over to Dr Young for the specifics.
The confusion on the gyms yesterday, Ms. Dart suggested about it, but can you sort of clarify what is the rule? Because there were a lot of people who thought that they had to wear masks inside, and then the terminology changed late last night that they didn't have to wear masks for strenuous activity.
Yeah, so for strenuous activity you can take the mask off, but otherwise you have to wear the mask inside. Yes, that's correct. So exactly what the Health Minister said.
So does that include, sorry, does that include like a class where people are in a room together, like a pump class or something like that?
That's my understanding, yes. Yep. But outside, you're outside, so it's different.
Now, other state communities have spoken about the need for a nationally consistent approach in terms of defining hotspots and having...
Well, we had a nationally consistent approach when it came to when I asked National Cabinet to declare Greater Brisbane a hotspot. Every other state and territory responded.
But I mean, Victoria's got this traffic light system, Queensland's got something different, Tasmania has something different. Do you think every state and territory should have the same process for people travelling to different states?
Well, it's a matter for each state, and each state will react depending on the health advice. But what we are seeing is the health advice coming through from AHPPC is genuinely consistent.
So you think it should be each state can do their own thing?
Absolutely, that's what we have been doing. But where there can be national consistency, that is a good thing. Like the declaration, when I asked National Cabinet to declare Greater Brisbane a hotspot, that is exactly what happened.
Restrictions as they are, do they follow people to the Sunny Coast, to the Gold Coast, if I go see family on the Gold Coast?
Yes, they do. If you've been in Greater Brisbane, understanding from the 2nd, then you must follow what the requirements are for Greater Brisbane.
Following on from that, then, just a question from the regions. Do you encourage people in regional Queensland to wear a mask if they know someone or in contact with someone from Brisbane?
Well, that's a matter for them, but if the person from Greater Brisbane has the mask on, well, then that minimises the risk completely. So, yeah.
A quick one from Canberra as well.
Yeah. Sure.
Passport vaccine, is there a public health order and then, as an aside, fines if people don't take it up, or we actually get to that?
In terms of the vaccine, look, that's going to be, I think the Prime Minister has said it's not going to be mandatory, but you will see myself and Dr Young and the Health Minister here, when the vaccine is available, we're happy to give public confidence and take that vaccine to show people that it is safe. Okay, I'll hand over to Dr Young.
Dr Young, there's some criticism out of ANU that short, sharp lockdowns are not effective, and Adelaide is one example that's been used. What's your response to that?
I think Adelaide managed their outbreak brilliantly. That was the Parkfield cluster, and in the end they only had 33 cases, which is probably one of the best responses in the country. We think here we had our Brisbane Youth Detention Centre cluster that had 50 cases, and we had the 5 initial ones that probably led to that, so 55. Whereas Adelaide, by doing that short, sharp, getting things sorted, finding as many cases as possible, so minimising the amount of infection out there, minimising the spread early on, I think it made an enormous difference. And that was with a variant that was less infectious. So we had to go and do something immediately, do it quickly and just get it managed. And that's what I think we've achieved. So I think that 3-day circuit breaker, really is what I'm calling it, just sets the framework. And the response here in Greater Brisbane, I think, was absolutely brilliant. I went out, people were wearing masks, people were socially distancing, people weren't going out. It was fantastic, and that happened immediately. Whereas to get the messaging out saying we've got to start, we've got to go back and socially distance again and do all those things would have been very, very difficult. So I do realise the absolute imposition. I understand the difficulties for business, but I think it has been enormously successful doing it. We'll now see the outcomes from it. So rather than just put in the 14 days with the restrictions that we've now got today, by starting the 14 days with those very, very rigorous restrictions, I think helps enormously.
On that
Contact
note,
tracing have to be done earlier for the hotel cleaners partner, given it was the more contagious strain?
No, because we tested him, remember? So we tested him on the morning of the 7th and we got that result back very quickly and it was negative. So that's our process. So now, given that he had those very mild symptoms later in the day on the 7th, we're going back to the 2 days before, and we've started that contact tracing last night.
Do you have numbers of contacts you've actually traced from him?
No. We started it last night.
With his workplace, have his work colleagues gone into quarantine?
The workplace is managing that for us. They're a very, very good workplace, very well organised. They've got an occupational physician who they employ, so we're working with them. But I have no concerns about that workplace. It'll be beautifully managed.
Has the genome sequencing come back yet? That is the UK strain.
No, it takes 24 to 48 hours to get whole genome sequencing results back. The other day, the reason we got it back so quickly within that 12 hours is there was just so much virus there, so it was quick to come. But usually it takes 24 to 48 hours.
What about the other 4 travellers who got the UK strain in hotel quarantine? Has their genome sequencing come back to match up with the women? Or?
The only ones that have come back to cluster with the gentleman in the hotel and the cleaner is his partner. So we just have to wait for the other genome sequencing. So that's the issue, that we can differentiate between people who've come from the UK and people who've got it directly from that man who came from the UK.
In regards then to the investigation that's underway, if we don't know how the virus has gotten out, the UK variant, how the cleaners got it, how do we stop the other 4 people who are in quarantine with the UK variant from spreading it to other people if we don't know how it got out originally?
They're all now in hospital, in a single room, negative pressure, being managed very, very carefully. And that's what our hospitals do every single day. They manage infectious people.
Dr. Young, have all of the close contacts of the cleaner now been tested?
Yes, I'll get that full information later, because we've been getting more and more coming forward. So thank you to all of you for getting the messages out about those different sites that I went again today, and we're still getting people coming forward who've been at those different sites. So I can't absolutely say that every single close contact, because some might only come forward this morning hearing the message again. But so far we don't have any other positives.
Dr. Young, with the investigation, is there a time limit on that? Like, when would you expect to have some sort of idea how she may have caught it?
Well, it depends what they find. So they're going into the hotel and they're looking at all possible options. So we've seen in other states that they've done similar investigations when they've had an outbreak related to a hotel, and so far they haven't found causes. So this is a very contagious virus, so I'm not sure that we'll necessarily find what led to this particular breach of the virus escaping, but at the same time we'll take the opportunity to make sure that everything is in place in that hotel and in all of our hotels.
Is the Deputy Commissioner able to comment on exactly what they'll be looking into? Is it CCTV or movements within the hotel?
So we've conducted a number of these sorts of reviews already into hotel quarantine, and we've been doing them as a matter of course throughout the response to make sure that systems are in play. So typically what we'll look at is, yes, CCTV, and there is CCTV that we have to go through for this, and it's probably 4 days worth, so that's going to take some little time. But what we do is we reconstruct the whole process that needs to be followed from the time that that person has entered into the quarantine system and how that's dealt with, and then we timeline all that, and then it's a matter of going through and checking with the people and the agencies and the others that are involved. So it'll be a complete reconstruction of everything that's happened so that we can understand the whole process. And I think, as the doctor said previously, it still may be that we will never get to the bottom of what has actually happened, because it could be something quite incidental to do with how infectious this disease is. But we will absolutely look at everything in the whole process.
Will that be 4 days from December 30?
It'll be the 4 days that that person's been in the system that we've had to be doing work that meant, when I say we, the people doing the quarantine, that they meant with the original male person that had the UK strain and the infected cleaner. So we're trying to work out the nexus between those 2 people and how it may have been transmitted. So that's a detailed piece of work.
Sorry, I just had a couple more questions for Dr. Young. Dr. Young, just on protocols within hotel quarantine, has it always been the case that people working in the hotels are required to wear masks?
Yes, PPE, appropriate for the role that they're in, yes.
And that was inclusive of cleaning staff, literally any member of staff working in the hotel?
No, not necessarily back of house staff, so in the kitchens. So these are people who have any interaction with the guests, the quarantine guests, or they're involved in cleaning the areas, involved in the areas.
But people working on the same floor, for example, of people in the rooms, they would all be wearing PPE?
Yes.
And so if a member of staff hadn't been wearing PPE on that same floor, that would be a breach of some kind, potentially a criminal breach?
I think we need to do the investigation and find out what's happened there before we make any decisions about whether it's a breach or a criminal breach.
Just to clarify on Victoria, is it still that Queenslanders should reconsider travelling to Victoria, or is that okay now?
Victoria won't accept Queenslanders from Greater Brisbane. If you go to Victoria from Greater Brisbane, you'll go into quarantine if they let you in. So I think that's why I was very careful to say this is about Victorians, not about Queenslanders. This is Victorians coming into Queensland. I no longer require them to be tested unless they've got symptoms. So I'm not going to comment about Victoria's requirements for Queenslanders because it's changing, as you would have seen, the permit system and so forth. So I think at this point in time it's probably good advice for anyone in Queensland, if you're going to travel interstate anywhere, that you go and make sure you look at what the requirements that state has put on Queensland.
Dr. Young, is there an agreement between the chosen each state about what should classify as a hotspot and when it should be revoked? I know Queensland's been 28 days, no mystery cases. Is that the agreement of each show that should be the rule?
I think we need to reset. We have now got a new variant that's 70% more infectious, so that's changed things. So I do think we need to rethink where we were, and that's what we've been doing at AHPPC. And we did provide advice to National Cabinet, who accepted that advice to change a lot of the processes. So it's changed since we had the agreement.
Dr. Young, are you surprised that we haven't had a case in the last few days? I mean, every time we get the numbers, we're surprised given this virus, this variant is so contagious. I mean, every time you wake up in the morning and you get that donut, are you surprised?
Well, we did get a case. We got the partner.
I mean, apart from someone who's been living with this person.
Yeah, just remember the incubation period is 14 days and there is no evidence that the incubation period for this new variant is any different. So we just have to wait, and we need to maintain all of the systems and processes we've all got in place as individuals to protect ourselves if this were to spread. So we just have to do what Queenslanders have done so brilliantly right from the start in terms of following all the advice and minimising the risk for everyone.
So are you thinking Brisbane should remain a hotspot for the next 10 days or 2 weeks, or what would your advice be right now?
I think it is a hotspot in terms of our advice here in Queensland, and whether other states or territories continue to leave it as a hotspot, they'll make their own decisions about the risk to their populations. I think we all sometimes forget, I certainly do, that every state and territory is very, very different and has very different relationships with other states and territories. We're all learning about movements across our country and where people move and when they move, all of those things. So yes, Brisbane, Greater Brisbane remains a hotspot from Queensland's point of view for the 14 days incubation period.
Another question for the Premier.
Yeah, last question.
Premier, your advice to the other states was to declare Brisbane a hotspot for their purposes. What's your view on that now, given that the Northern Territory, for example, has lifted that designation, Victoria hasn't?
That's a matter for them.
But you advised the other states
that we were going into a 3-day lockdown, and that 3-day lockdown has ended. So that's a matter now for them. Sorry? Yeah, I did. And the 3-day lockdown has ended, and now it's a matter for them. But we will consider to observe that incubation period for those additional 10 days. We've been very clear. Okay? Thank you.
Thank you.